Hi, my name is Robert Thorpe, and today I'm going to be giving a presentation on Lyme disease. Okay, here's some generic information about Lyme disease. It's also known as Lyme borreliosis, and it's almost always transferred through a tick bite. Infected ticks carry a spirochete called Borrelia burgdorferi, and a spirochete is just a spiral-shaped bacteria. In the United States, there are two main carriers of the spirochete, and that's deer ticks, and they're also known as black-legged ticks, and we also have western black-legged ticks on the west coast. Lyme disease can be found in 49 states and Washington, D.C. Here's a picture of different stages of the deer tick. We have the nymph, the larva, and then the adult ticks. Normally, the larva and nymphs, they basically feed on deer and mice, and those warm-blooded animals are what carry the spirochete, so that's how the tick itself gets infected. And then what happens is the nymph get pretty active during the spring and summer and end up attaching to humans, and that's how humans end up getting Lyme disease. Okay, so as I said, it's transferred to humans from a tick bite, and that's actually from the tick's saliva. Transferring happens after the tick's been attached about 36 to 48 hours, so if you find one pretty soon afterwards, then you should be okay. And initially it affects the skin, and then it spreads to the organs, joints, and nervous system. And it spreads through the host bloodstream or lymphatic vessels. Okay, prevention, the main types are just when you're outdoors and then after you've been outdoors. So when you're outdoors, you can wear light-colored clothes, and basically if you just see a tick on it, like it might make it easier to spot ticks on yourself if you have light-colored clothes. You can stay on clear trails away from tall grass and wooded areas. And you can also avoid sitting on the ground or stone walls. And then you can avoid tick-infested areas in the spring or summer, and that also helps. After you've been outdoors, what you can do is you can just check for ticks. And when you're removing ticks, especially with tweezers, don't crush the body. Because if you end up crushing the body, what can happen is you can get some saliva on your fingers, on your hands, and then if you eat something, you might accidentally ingest it, and you can get Lyme disease that way. And then another prevention method is to shower to wash off the ticks. That's just because sometimes it takes them a while to attach. Okay, there's three different stages of Lyme disease. The first one is localized acute, and this is recently after the tick bite. About 80% of people show signs of erythema, and this is the most evident warning sign, and it looks like a bullseye, and it expands slowly over time and tends to be painless. During the acute stage, you also would have mild flu-like symptoms, and that can be like body aches, night sweats, just fever, just things of that nature. And then you can also have a possible oversensitivity to light and sound, and you would use practice pattern 7B in this case. And here's a picture of several different types of erythema. And what it's mainly going to be is it's mainly going to be a dark red circle on the inside surrounded by a light reddish circle on the outside. Okay, stage 2 of Lyme disease is the early disseminated infection. And this usually happens about 4 days to a few weeks after the spirochete spreads throughout the body. And about 15% of people show neurological signs. So this can include facial nerve palsy, cognitive impairment, and inflammation of the brain, spinal cord, or the nerves. And inflammation of the brain can cause things like ataxia, seizures, and Parkinson's-like syndromes. Also, 50% of patients develop Lyme arthritis, and that's a unilateral swelling of one or multiple joints, and it can also lead to musculoskeletal pain, and this is joints, muscles, bursae, tendons, and bone. And then also less than 10% develop Lyme carditis, and this can give you heart palpitations, or it can cause bradycardia and just other heart problems. Associated practice patterns are 4D, 5C, 5D, and 6D. So the last stage of Lyme disease is late persistent infection, and in this stage you have intermittent arthritis and some disabling neurological disorders, and this leads to confusion, disorientation, dizziness, short-term memory loss, and an inability to finish sentences. So it might be like a mental fog is what some people would call it. There's radiculopathy, and that's numbness in upper and lower extremities. And then 5% of people who actually don't have their Lyme disease treated may have paresthesia. And even after people get treated, then they might still have post-Lyme syndrome, which is going to basically last for a few months to possibly a few years. And this includes fatigue, headaches, joint and muscle pain, cognitive difficulties, and just sleeping problems. Okay, there's also medical testing, and to actually be tested for Lyme disease, you need to go to the doctor, and you want to go if you actually have any of the acute symptoms, signs, and that's going to especially be the erythema, the bullseye mark, and then also if you've been recently bitten by a tick. Also, there's an ELISA or a Western blot blood test, and these are fairly accurate after about a month. So if you think it's been about a month since a bite and you're not sure, you might want to go check and get that test done. And also there's a PCR test, which is a polymerase chain reaction test. And this is for neurological symptoms. And what it is, it's either a spinal tap or else a removal of synovial fluid to check for that spirochete. Okay, as far as medical prognosis, early treatment is vital. Antibiotics are given for 14 to 21 days. If neurological symptoms are present, then there will be an IV that has antibiotics, and that will go for about 2 to 4 weeks. Anti-rheumatic drugs are also used if the person is showing signs of Lyme arthritis. And a relapse is possible, so if this does happen, then what they'll do is they'll add another cycle of antibiotics for the treatments. And then there is no immunity, so basically if you have gotten it and you hunt or you're outside in the woods a lot where you might see ticks, then you need to be careful and take preventive measures. Okay, impairments, there's neural and physical. For neural, we have a lack of sensation, increased pain, impaired cognition, and uncoordinated movements. For physical, some are decreased range of motion, edema, connective tissue dysfunction, and decreased strength. And as far as functional limitations, you can have decreased ambulation, frequent falls, or you can have decreased functionality in activities of daily living. And for disabilities, this would be inability to perform self-care, household work, and recreational activities that you might enjoy doing. As far as physical therapy, it really just depends on what this particular patient has. If they do have Lyme arthritis, then they might need stretching, strengthening, and protection of joints. This is going to help with the range of motion, especially the stretching, and then the strengthening is going to help actually protect those joints. And then also massage, joint mobilization, and myofascial release is important. And this helps with any kind of swelling and also addresses the pain, which the ice heat and ultrasound can also help with pain too. For facial palsy, you can use e-stim and biofeedback. And then also patient education is important because they need to know that they need to protect those joints, have good posture, and they need prevention education. Okay, some precautions are patients need to be cautious not to overexert themselves. They usually have that fatigue when they do have Lyme disease. And then also they need to make sure to be careful of joint protection. Because they might be having the arthritis symptoms, or they might have some kind of tissue laxity from their connective tissue. And for contraindications, they do not want strenuous exercise. This can cause a lot of things to go bad. And then also e-stim and biofeedback can be a contraindication if the patient does have heart palpitations. Okay, and lastly, some things to consider is Lyme disease should be taken very seriously. It can be hard to diagnose because it is an imitator disease, so it shares a lot of symptoms as the flu, MS, arthritis, things of that nature. It affects musculoskeletal, neuromuscular, and the cardiovascular system. And Lyme disease cases are on the rise. Also, taking proper precautions while outdoors can greatly reduce your chance of being infected. And it is important for the therapist to take note of all the patient's symptoms in order to choose appropriate treatments. Thank you. That's it. I hope you've learned a lot about Lyme disease, and that's the end.